back to Living 808. Breakthroughs in the treatment of lung cancer have their beginnings in research labs and clinical trials. Now, Dr. Richard Lee with the Cancer Center of Hawaii is here to talk about how patients can access state-of-the-art medical treatments and help advance medical science by participating in these trials. Hello, doctor. Thanks for joining us.
Thank you.
So, lung cancer, I hear that that's one of the most common cancers in the world, but very difficult to treat. Is that true?
Yes, it's definitely one of the most common cancers in the world because of smoking, and it's very difficult to treat if it's caught, because it's caught a lot of the times in the late stages. But more recently, in the past few years, we've been catching them early with CT-based screening and catching them at an earlier stage, which is more manageable, and you can get higher rates of cure. Unfortunately, you got that other half of population where they're caught at a late stage, where they're started in the middle of the lung and they go to the middle part of the chest, making it very challenging to treat. The best way to treat them for these locally advanced cancers is with a combined modality, but sometimes if surgery isn't possible, then you have to treat it with just chemotherapy and radiation alone.
Okay. We are talking about clinical trials today, and last month you explained what that is and how it benefits, right, the medical field and also individuals. What are some trials that can treat lung cancer?
So the one that's currently open by the University of Hawaii Cancer Center and our Cancer Center is we look at the current trial called SWOG 1206, which takes locally advanced lung cancer patients and randomize them between the standard arm of chemotherapy and radiation, or chemotherapy and radiation followed by what we call an agent called veliparib.
So that's the main one, is this SWOG 1206 that you're treating now?
Right.
Okay, but there are others?
There are others, like the metformin trial that was recently closed, and the one that's about to be open is the PD-L1 inhibitor called nivolumab. It stimulates the immune cells to attack the cancer cells.
Okay. If someone wants to be a part of the clinical trial for lung cancer, how long does it take to get the results?
That varies by how common the cancer is, the number of patients to enter the trial, the patient's willingness, and of course the healthcare provider trying to get the patients into the trial. All these factors play a role in trying to get results from the trial. So it can take like 5 years to enroll a patient in a big phase 3 trial, which is a randomized trial. And fortunately, there's something called interim analysis that looks at halfway points to say, is this drug working? Is it not working? And so we can give like a feedback mechanism whether what we should do in the middle of the trial. But ultimately, it takes a long time.
Okay. If you are watching and you want more information, they can talk to their doctor, right, to see how they can get involved with a clinical trial.
Yeah, and that's definitely a key thing. It's because every patient is different, so we have to look at their eligibility, enrollment. Do they have a history of heart issues, diabetes, kidney problems? These all play an important role in whether they're eligible for a trial, because these drugs can have an effect on their other body organs, and that they have to make sure it's safe.
Dr. Lee, thank you very much. I know that this is a lot of information and it may go over your head, but we're going to post the information on our website. And again, the main thing is to know that we have a place here in Hawaii where people can be a part of a clinical trial. And for more information, everyone can speak with their doctor. So thank you very much. We're going to have much more on Living 808 when we come back. Stay with us.